Telia starts. How do you stop your heels from hurting after walk, not jog, but walk? The problem with that is that you need some support. You could have pressure on the tendons. And believe it or not, the problem is the heel hurts, but the problem is the arch of the foot. The arch is basically a collection of tendons that go from the heel, the bottom of the heel, that go to the bottom of each toe, and they grab the toe and they pull the toes so that your toes can clasp like this. That is a significant and important part of you standing and walking. Those toes clench down and push you off as you move forward. So if that arch is not appropriate in the tendons and giving you an arch in your foot, because they're supposed to be held in place by another mess of tissue. Sometimes that tissue stretches and whatever, and so there's no arch, and the pull is directly from the heel to the toes. That causes a condition called plantar, the bottom of the foot, fasciitis, or inflammation of the fascia of the foot. Now, you can help that most times with just a custom-made insert, or you can go to one of these places that has a Dr. Scholl's foot section in a department store like a Walmart or something. You literally put your foot in a mold, and the mold measures and evaluates your foot, and then it recommends there's a whole wall of various types of inserts that you can choose from. And it will recommend what you should try. I would say try a few of those before you find one that maybe doesn't work. Sometimes you have to have a custom mold made by a foot specialist or a podiatrist who can evaluate your foot and make a mold that is unique to you and fits your foot perfectly. Other times, it can be treated with injections to calm down the inflammation. Sometimes it requires a surgical release and repair of the arch so that your feet aren't flat anymore. And that's what it looks like. You have the flat feet. They will put an arch in your foot, so now your foot is going like this, so that pressure is not there and those tendons are not pulling on the bottom of your feet, and you're pulling your toes the way you're supposed to. So very important that you're wearing shoes that are appropriate. You don't have to wear $300, $500 Nikes, New Balances, or any other shoe like that. Just has to be a decent shoe with a good arch support in it, and wear some cushioned socks as well when you're walking. So again, walking, not jogging. The difference between the two is that when you walk, there's a smooth transfer of your body weight from one foot to the other. There's no shock to your knees, hips, and ankles. When you jog or when you run, there's a flight phase where both feet are off the ground at one time. And when that first foot plants, it puts 20 to 30,000 pounds of pressure on your knees, hips, and ankles. And that always results in trauma over time. That's why people that do a lot of jogging and running always end up with knee and hip problems over time. And people that walk don't. It's just that simple. And guess what? There's actually more benefit to walking than running. The reason why, one, you have no chance of injury with walking unless you just slip and fall over your own 2 feet or tripping through a hole or something. But more importantly, you will walk for longer, so your cardiovascular fitness achievement is higher, because you may walk for half an hour, but you're not going to run that long, particularly when you first start running. So once we found out, the common sense thing is most people would think running is much more benefit than walking, until a scientific analysis was performed to see just that. Guess what? Dr. Collier participated in that during the 1996 Olympics here in Atlanta. We found out that you actually are much more benefit from walking than running, and you lose weight more, your cardiovascular fitness level is more, you are more physically fit from walking than running. Great question, Telia.